Hi, I'm Dr. Pavitra Nagaraj, Pediatric and Adolescent Endocrinologist working at Narayana Health City, Bangalore. 19th to 25th September is celebrated as the Growth Awareness Week. What do you mean by growth in a child is physical growth to mental and psychosocial to many other multi-factors are involved in the growth process of a child. So let me talk or stress more on the physical growth, which includes the weight and the height of the child. As I'm an endocrinologist, I would want to stress more on the height of the child. So when we say awareness, what do you mean by awareness is that I want to aware all the pediatricians and the parents to plot the height of a child on the growth charts. What are growth charts are graphs which is for age specific and also gender specific, that is it's different for each age group and also boys and girls. It is very simple. Whenever you visit your pediatrician, please plot the height of the child or the length on the growth charts which is according to the age. So that is when we get to know if the height of the child is appropriate for the age or not. The second point is that the MPH, that is the mid-parental height, which includes the mother's and the father's height, also to be checked because there is an entity called familial short stature, which is if the parent or the mid-parental height, that is the target height, is low, then even the child would be a short child. So it is important to plot the parent's height as well. There is also another entity called constitutional delay, for which we need a history from the parents that if the mother or the father had a sudden increase in the height during their high schools, that is during their pubertal age group. So it is important to have this history. If any one of them had the history, even the child would have the history of constitutional delay. If when you're plotting the height on a growth chart, if there is a sudden drop or sudden increase in the height, both are of concern, and that is when you have to meet the specialist. The other one is also that if the graph is much lower than the target height, that is also the point where you have to meet the specialist. So on this awareness week, I want to tell everybody to plot the height on the growth charts so that the short stature in the child is picked up early and we could treat all the children with short stature. Why I'm telling you this is many children come to us, an endocrinologist, at a very later stage where the final height is already achieved. So it is important that we plot the height on the growth charts so that we help children grow taller. Thank you.